dimensions of the toothbrush or the amount of toothpaste that should be used during toothbrushing. So one of the dentists said, accordingly, if the mothers don't know how to brush their teeth, the children, they won't be able to brush their child's teeth in the right way. So he said, if they don't brush their teeth the right way, they will not brush their children's teeth the right way either. And most of the mothers didn't know the right time of toothbrushing initiation. So one of the mothers said, no, I haven't started to wash them, her 8-month-old child teeth. The teeth are still very small. Also, the ones above aren't erupted yet. That's why we haven't started brushing. Treatment pain and fear of dentist was mentioned by the child as the motivation to visit themselves and their children to the dentist. So they thought that it would be better to take the child for the first time to the dentist when he gets older, so that he would tolerate the pain and would understand the treatment that's going on. So one of the mothers said that in this age, younger than 3 years old, to take them for a checkup and then later to make the child feel bad towards the dentist, I think that would not be right. And the mother said that it would be easier for them if the dentist was a familiar person for them and the child, and if the dentist is a trustworthy person and is expert in his field. Time constraints was one of the important findings in the enabling factors. So the mothers said that it is hard for them to follow correct toothbrushing and routinely visiting the dentist, but the working and non-working mothers said that they were unable to routinely visit the dentist and to toothbrush their teeth twice a day. But in that interview, participants said that it's true that the women in our country are really busy, but also they don't give much importance to the dental issue. So one of them said, in our society, women are very busy also. They might not give importance to visiting a dentist because of being busy and also because of not giving it high priority. The mother said that it would be encouraging for them to visit the dental clinic, if it is close to their homes and if it has a child-friendly atmosphere. They also mentioned that the financial assistance would be also an encouragement. While the in-depth interview participants said that the financial assistance it really would make it easier, but if the dental clinics were part of the polyclinics, that would help a lot. So one of the in-depth interview participants said, if these dental clinics were in primary healthcare facilities, I think mothers would take their kids anyway. The lack of oral hygiene skills among the mothers was also an important finding in an enabling factor. They thought that brushing their child's teeth is really challenging. They didn't know how to convince an uncooperative child to brush his teeth or to hold the child in a comfortable way so that it would make the toothbrushing properly. They also said that they never get advice from the pediatrician, so they thought it would be good if the pediatrician gave some advice. So one of the mothers said, I think since we take the children regularly to the pediatrician, I think the pediatrician's role here is very, very valuable to guide us the right way. Now the mothers thought that the dental visit for their children would be really comfortable if the dentist knows the right way and the nice way to treat the child. So one of the mothers said, the doctor should know how to establish a contact with the child, the way we say it, to find the tongue. Many mothers said that they themselves and their husband take the decisions of dental health for their children, and some of them said that they use the internet to have the knowledge. So one of the mothers said, I wanted to say time when there is online access and there are many different free resources that a person can get advantage of the internet. But basically a person should know what resources to read. But the mothers also said that they might get encouragement from their family members, and sometimes there were some of the mothers who were discouraged by mothers surrounding them. So one of the mothers said, I know that we should take care of them starting from the first tooth, but there are many opinions telling me she is still very young, why you would do it, why would you pay attention to that, she is a child. To sum up, our mothers didn't implement the oral hygiene practices according to the guidelines. So they didn't brush twice a day. They didn't visit the dentist every 6 months. And some of the reasons were lack of skills of the mothers and lack of their knowledge. They didn't know the right way to do it, although they knew the importance of the oral hygiene. Also, time constraints was one of the reasons. And also, discouragement, lack of advice from the pediatrician was kind of disencouragement for the mothers. So to cover this gap, it would be good to raise awareness in the mothers through gatherings in the kindergartens and the polyclinics. So the findings of our study were mostly consistent with the literature. And finally, the strength of our study were that it was the first qualitative study exploring oral hygiene in children under 3 years in Armenia. We used a theoretical framework to explore the phenomenon of interest, and we maintained the rigor through triangulation. We interviewed three groups of stakeholders, and the student investigator is a dentist, which increased the credibility. Also, along with the qualification of the researching team. Another strength was that the recruitment were mostly with familiar people to the student investigation, which encouraged openness during the discussion. But also it was a limitation on the other hand, because higher socioeconomic economic and educational status were overrepresented in the sample. And finally, another limitation in the study was that the study included only respondents from Yerevan, which did not give us information about the experience of mothers living in the regions. Thank you. Questions?
Thank you, Colin, for the presentation. I have a question for the little one. You said that majority of mothers didn't know even the right movements of cleaning the teeth. How would you ask this question?
Actually, I didn't ask it specifically. They said by themselves. I asked them what did they know. Yeah, only two showed how was the right way to brush. But I asked them what do they think about the rules of toothbrushing. So they were mentioning when they should brush during the day. And only two mentioned that. One mentioned that it should be done like the wrong way, and another one said, maybe one or two said that they should do it the right way, like the motions from upward, downwards, and etc. Welcome. Thank you for your question.
So you mentioned that most of the findings were consistent with the literature. What were the findings that were not consistent?
As I said, that pediatricians in the country don't give advice to the mothers. I found that in the United States, really long time ago, probably in 2000, they had a study, and most of the pediatrician dentists even looked at the teeth of the child, and they saw if there is a dental caries, and they refer the child to the dentist. So yeah, this was inconsistent. So the pediatricians really gave advice, even taught the mothers how to brush their teeth. So this was one of the contradictions.
Other questions, comments?
Yes.
After the interviews, whether mothers approached you about to consult you whether they are doing right things or wrong things, or whether they ask your help as a dentist?
Yes, actually, after the discussions, I provided recommendations for the mother. I gave them a booklet where it included the guidelines, how to take care of their really young children. Also, it included photos, how to hold the child toothbrush, and they also kept asking me questions about everything they wanted to know, even for themselves, like whitening their teeth, how do they do it, and that kind of stuff. So.
And also, could you describe more detailedly how did you do your recruitment?
Yes, so for the mothers, I recruited them through kindergarten, one of the kindergartens in Yerevan. This was one part of the mothers. Another part was through social network, and also I recruited familiar mothers who I knew from my society. And for the pediatric dentist and the dentist and the public health specialist. So the public health specialist was one of the healthcare specialists working in Kuwait. So I did my internship there, so I cooperated with her many times. And the general dentist was recruited like in a snowball. One of my participants referred me to him. And the two pediatric dentists, I knew them actually, not in person, but I kind of, luck, someday I got their phone number and I called them and they accepted to participate.
I have a small question.
Yes.
Those pediatric dentists,
Mm-hmm.
do they work with children below 3 years old?
Well, if the child comes, yes. Well, but rarely actually. They said they would be happy if the child comes and with no problem or for just a checkup. Rarely, but rarely.
Thank you very much.
Thank you.
So, and we'll have the concluding presentation by Shovan Muradan.
Good evening, everyone. I'm Shovan Muradan, and my thesis topic is about qualitative description of experiences of dealing with TMDs, temporomandibular joint disorder symptoms in Europe and Armenia. So I will start introducing the outline of the presentation. It will consist of introduction, methodology, results, discussion, and recommendation sections. And let me first define the two terms that I will use constantly during the presentation. TMJ. TMJ is the acronym for temporomandibular joint. It is the joint located between the lower jaw and the skull and responsible for moving the jaw forward and from side to side. TMD is temporomandibular joint disorder. It is a subgroup of chronic orofacial pain problems, and